Interesting story right here. This comes from the New York Times. Black pregnant women are tested more frequently for drug use, study suggests. Researchers say racial bias was the only explanation for excessive testing of black mothers at a Pennsylvania health system. Black patients were no more likely to test positive for drugs than others in this study of 38,000 patients who delivered a baby in a large healthcare system in Pennsylvania between March 2018 and June 2021. Medical apartheid. Hospitals are more likely to give drug tests to black women delivering babies than white women, regardless of the mother's history of substance abuse, suggests a new study of a health system in Pennsylvania. And such excessive testing was unwarranted, the study found. Black women were less likely than white women to test positive for drugs. The study analyzed electronic medical records of 37,860 patients who delivered a baby at a large healthcare system in Pennsylvania between March 2018 and June 2021. Okay. The report comes amid a national conversation about health disparities and systemic racism in medicine, one that was triggered by the COVID-19 pandemic's disproportionate toll on communities of color. There we go with that color. Excuse me. Where was communities of color, community, and that it. Okay, let me start over. The report comes amid national conversation about health disparities and systemic racism in medicine, one that was triggered by the COVID-19 pandemic's disproportionate toll on communities of color, and that has focused more recently on high maternal mortality rates among Black and Native American women. Let's get that out of the way. As a scientific community advances its understanding of cancer, that's not part of the story. The authors of the new study urge hospitals to examine their drug testing practice in order to address racial bias. Any given clinician may not be thinking about bias, but when you look at these kinds of data, you can see there is no other explanation, said Marian Jarlinski, an associate professor of health policy and management at the University of Pittsburgh School of Public Health and the paper's first author. The findings are a clear illustration of desperate care, said Dr. Allison Stubbe, a professor of obstetrics and gynecology at the University of North Carolina, who was not involved in the research. This study is one example of how provider behavior causes black women to distrust the healthcare system. After controlling for various demographics and medical factors, the researchers calculated the probability of urine toxicology testing for different groups. Although more black women had reported prior drug use, mostly of cannabis, the difference did not fully explain the results. Black patients had the highest probability of undergoing urine tests and delivery regarding of their prior drug use. Excuse me. Among those who did report substance abuse in the previous year, The likelihood of being tested was 76% for black women compared to 68% for white women. Yes, white women with a history of substance use were more likely to test positive. About 66.7% were likely to test positive, compared with 58% of black patients with such histories. Even among women who had no history of drug use, black women were more likely to be tested. About 7% of black patients with no history of substance use were likely to be tested, compared with 4.7% of white patients with no history, the study estimated. Hospitals screen for drug use on labor and delivery wards in order to comply with federal and state regulations for safe care for infants affected by substance use during pregnancy. It's not clear what led to greater drug testing of black women at the Pennsylvania health system. Come on, man. Come on, bruh. We all know what led to it. Some of these writers, it's the New York Times. What should you expect? Let me read that again. It's not clear what led to the greater drug testing of black women at the Pennsylvania health system. Racism. Yes.
Do you have WD-40?
What you need WD-40 for?
My PlayStation?
Check in the back room. It might be some on the shelf. Excuse me. My daughter asked me about WD-40 for a PlayStation. Let me hurry up and finish this so I can help her out. All patients entering the labor and delivery department were screened verbally for substance use with questions adopted from the National Institute on Drug Abuse quick verbal screening test. The policy called for running urine toxicology tests on patients with positive results from the screening test, a history of substance use in the year before delivery, few parental visits, or a poor birth outcome without a clear medical explanation. Both substance use history couldn't fully explain the results, and researchers found no racial differences in number of paternal care visits or the rate of stillbirth. That's bullshit. In addition to calculating probabilities, the study reported the raw number of patients who were tested for drugs. While about 21% of black patients had reported a history of drug or alcohol use, 25% underwent urine testing. Most of the black women had reported cannabis use. In contrast, 9% of white women had reported a history of drug use, including cannabis, opioids, while 10% were tested for drugs. Of the black mothers tested, 40% had positive urine toxicology tests compared with 51% of the white mothers. Wow. Is that the end of the article? Numbers don't lie, they say. Yeah. Just more racism, and they don't want to call it what it is, but it's racism. Plain and simple, it's just racism. All right. Please like, share, and subscribe. Let me know what you think in the comments.